pandemic, there's been a lot of talk about long COVID, but new research now shows there could be potential long-term impacts of routine viral illnesses like the common cold or flu. Nearly half of people with the flu experienced at least one symptom also associated with long COVID. According to the CDC, about 14% of U.S. adults reported having symptoms of having long COVID at least 3 months after having the virus. For more on all this, we welcome Dr. Susannah Hills here in Studio 57. She's a pediatric airway surgeon and professor at Columbia Medical Center. Thanks so much for being here.
You're welcome.
There's so much to get through, and it sort of feels like one of those times when everyone you know is getting sick. So this is really critical and important information because 3 years post-pandemic, here we are. We have learned a lot about viral illnesses and the impact that they can have. So let's start with talking about the long-term impacts.
It's really, really interesting what we're learning now. We're sort of starting to think about viruses in a different way. We used to think of them as, something where you get sick for 5 days, for a week, and then you're done. And what COVID has taught us, and now this new research about the flu, is that we may be seeing effects for months or even longer after a virus. And we really have to try to understand this better. Why is this happening? Why are some people getting these symptoms for a much longer term?
And so what are some of the symptoms of long flu or long cold?
They can be really variable, but we're hearing things like fatigue, headaches, brain fog. Everybody's talking about brain fog, or just feeling a sense of being unwell, getting tired more easily than you used to.
And so there is this data that we're looking at, a 2021 medical study finding about 40% of people with the flu experience at least one symptom associated with long COVID, some of the ones that you spoke about. What do doctors know about this connection between long-term viral illnesses and how these symptoms can be treated?
What we're learning from the research we've done about COVID over the last few years, and now this new research about the flu, is that people are somehow predisposed at times to having longer effects of the virus. For whatever reason, and we don't fully understand the mechanism or how this works, there's a group of people. Well, it tells us we have more research to do. It tells us two things. We have more research to do to better understand this so we can find out why and treat it better. But it also is telling us that because some people are going to get long-term symptoms, maybe thinking about getting to the doctor, getting treated, and maybe seeing what virus you have may make a difference. Because if you have the flu, there's antivirals like Tamiflu available. If you have COVID, there are antivirals for COVID available. So maybe getting on top of it and treating it might be a wise thing to do. Certainly keeping in mind if you've been sick and you have long-term symptoms, talking to your doctor about it and trying to sort that out makes sense. But yeah, we have a lot to learn.
This is an important point because I think there is some testing fatigue. Right now, because people just almost don't want to know. That can be an important reminder because when you do know what you have, that helps to treat it.
It does, and if you're in a situation where you've had long symptoms from a virus before, then that might make you more inclined to get tested. For example, if you're higher risk because you have an autoimmune disease or other health factors that are going to put you at risk for issues with your organ systems or issues with other long-term problems, then getting tested may make sense. What we do know is the long-term effects of COVID may be more severe. Certainly, we're seeing that they're likely to affect a broader array of organ systems like the heart, like the kidneys, like the liver. Flu really tends to affect the lungs. So the long-term effects from flu tend to be fatigue and pulmonary symptoms like prolonged cough, things like that.
Okay, got it. Lots of great info there. Thanks so much for your help this morning, Dr. Susannah Hills. We appreciate it.
Thank you. Happy to be here.